Good afternoon, everyone, and welcome to our webinar this afternoon entitled Inspiring Harm Reduction into Action. Thank you for joining us. Please note that this webinar will be recorded and may be archived for future viewing on the RNAO website and shared publicly with fellow attendees and interested parties. If you participate in the chat, your comments, questions, and name may be read by the speaker or the facilitator. As well as your video is on, there is a potential for your image to be in the recording. Your participation is implied consent to be recorded and posted on the RNAO website. Should you have any questions, please contact info@rnao.ca. Good afternoon, everyone. My name is Sabrina Morelli. I'm a registered nurse and the program manager for the Mental Health and Substance Use Program here at RNAO. And it is my absolute honor and pleasure to welcome you all to our today's webinar entitled Inspiring Hope, Harm Reduction into Action. The webinar takes place in honor of International Overdose Awareness Day, which takes place every year on August 31st. I'll take a moment to conduct a land acknowledgement. We recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We wish to acknowledge that the office of the RNAO is located on traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territories of the Mississauga of the Credit. This territory was the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. We recognize that the participants of today's webinar are located on other traditional lands across Ontario. And today, this land is home to many First Nations, Inuit, and Métis people from across Turtle Island. And we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part of an act of reconciliation, honoring the land and Indigenous heritage, which dates back to over 10,000 years. We encourage you to learn about the land that you reside on and treaties that are attached to it. Land acknowledgements are part of an act of reconciliation, and we must all do our part. So a few housekeeping items before we start today's webinar. Please note that this is our first time using Teams platform. We don't anticipate there'll be any hiccups, but if there are any, please bear with us if they arise. Hopefully they won't. Please ensure your microphones are turned off during the webinar. When we reach the Q&A portion of the presentation, you are welcome to unmute and chat with our guest faculty today, or put your questions in the chat and I'll read them out. We will be recording the webinar as mentioned earlier today for the speaker portion of the webinar for the future viewing for participants and others. The Q&A portion will not be included in the recording. And then after today's webinar, you will receive an email with the link to today's webinar evaluation, as well as our resource sheet and our speaker bios. Please take a moment to complete our evaluation as your feedback means a lot to us. And with that, here are our esteemed panelists. It is my pleasure to welcome Kasia Zorowski from Sanguine Health in Waterloo, Ontario, Pamela Tapley from the National Overdose Response Service that is run out of Hamilton, Ontario, Kathy Moreland, who is the chapter president of the RNAO Windsor Essex and a member of Mom Stop the Harm, and Julia Shi, who is a nursing and health policy analyst at RNAO. Thank you for all being here with us today, and I will now turn it over to Kasia.
Fabulous. Thank you so much, Sabrina and Amber. So as we start off our discussion ahead of International Overdose Awareness Day, we need to understand the current climate of substance use. How did we get to where we are today? The act of consuming substances hasn't changed, but the policy surrounding drugs and drug use has. These policies criminalizing people who use drugs and drug use has led to the development of the unregulated and unpredictable supply of drugs we see today. Unregulated substances can be dangerous because we aren't aware of the contents, strengths, or truly what you're getting unless you're able to test them with a drug testing machine. My colleague has a great analogy for baking chocolate chip cookies that I'm going to use. If we're baking cookies at home with chocolate chips and we're scooping out the dough, one of our cookies may have 5 chocolate chips. One of our cookies may have 6 chocolate chips. Some may have 1 chocolate chip and the other may have 10. So the supply, as to leaning it over back to drugs, can be just as unpredictable. There are many levels that we can address the dangers of unregulated substances. At a system level, a way to decriminalize, which is very different than legalization of substances, can add more, and adding more services can support people who use drugs and their families. But as individuals or people who use drugs, we can't change the systems in one day. But some strategies that we can use to implement right now include a supervised consumption site if possible, use with a trusted person, have somebody check on you, which Pamela will kind of go through with their experience working at NORS, carrying naloxone or Narcan, starting low with your substance and going slow, and testing your drugs if possible. So, with statistics, there are many ways that we can measure the impact of how the unregulated drug supply and a large percentage of Canadians are using drugs. It should be noted that although I will be touching on some statistics, each of these numbers is a person who was lost to drug use. Each of these is a person who was loved. Each of these was a family member, a friend. So I don't want that to kind of go under the radar. Looking at the Ontario Drug Policy Research Network, or the ODPRN, we can see that there is a significant amount of people who lost their lives as a result of drug-related or toxicity, with almost 2/3 being in June alone. This kind of comes on the tail end of the Ontario government and a lot of action surrounding defunding harm reduction. This is no surprise because our current government is currently moving towards more of a defunding of harm reduction rather than adding more services that could support people who use drugs and their family. These numbers also come on the heels of many CTS closures across the province, including the one that I worked at in April 2025. I encourage you to take a look at some of the action alerts and organizations that really are supported by the RNAO, but are a public call for action for the Ontario government to truly take back their decision on closing the supervised consumption sites and bringing more funding back to harm reduction. I'm going to move a little bit and talk about my organization. So Sanguine is a nonprofit community health-based health agency with offices in Waterloo and Guelph, Ontario. Sanguine Health Centre offers a person-centered practice of care where service planning is specific to an individual's desire for support. Our team uses harm reduction as it's a foundational pillar. Our mission is to compassionately serve and empower individuals in the Waterloo region and Wellington, Dufferin, Guelph area who are living with or at risk of hepatitis C. We achieve this by delivering unparalleled education, targeted outreach, unwavering support, and top-tier medical care, ensuring that comprehensive and compassionate assistance every step of the journey towards wellness. At Sanguine, we believe that people living in at-risk communities deserve compassionate support and accurate information to help them make informed choices. We have a lot of different programs at Sanguine. I could make a whole presentation, and we do have one, in terms of everything that we offer around our area. I'm going to go through a couple that we have now. So this is our mobile health bus. This is a doctor's office on wheels that provides support for individuals in our community. As you can see here, there's the bed, examination table, and medical equipment that is located on the back of our bus, where we stop in areas where folks may not have traditional access to traditional forms of healthcare. This is the front end of the bus where there's a little table or chair where you can get blood work done, a wheelchair ramp or an accessible ramp for anybody who needs support, and tables where a lot of our awesome team works to give people the support that they need. I'm also going to brag about our health van. So different than the bus, these folks are truly so amazing. They go to different areas around Kitchener-Waterloo, Cambridge, Guelph, and provide people with a variety of different food, household, healthcare-based supports, and also harm reduction. So where you see the people standing at the back of the van, that's where we give out all of our harm reduction gear, traditional to where we had our needle syringe programs and other harm reduction distribution programs, as well as on the side of the van where we usually get food donations from our food bank, hygiene products from the food bank and other private donations as well. If you have any questions about services or opportunities to donate, we have a banner on the bottom of the screen and something in the chat where you can go and touch base with that. Sorry, give me 1 second. Perfect. The next slide is definitely something that is more unique to our program recently. That is the harm reduction drug testing machine. So recently we had our drug testing machine at our safe consumption site. With the renegotiation of locations and reapplication surrounding that, we have it both standardized in our new location and the ability to take it mobile to a couple different fixed sites. So wherever the van is going in the community, this drug testing machine is going as well. Depending on the time that you have to provide your sample, you can get a really in-depth overview of what is in your drugs. The best part about this is that you get all of your substance back, so you're not sacrificing it. And if you do want to have a far more detailed overview, you can send it away, and we have a partnership with the university that will far deeply more analyze it. But unfortunately, in that instance, you will not get it back since it is going for further testing. I want to end this with just some pieces about harm reduction, how I got into it, and if you're ever curious about it, what advice I would provide you for taking the leap into this specialty. So I got into it after spending a career in mental health and psychiatrics. I was in very different settings all over the province, just based on my partner's movement. But I noticed there was a lot of gaps associated with some of my patients, clients, family, friends who were trying to get support who use drugs. When I did some research, I came across a lot of different harm reduction methods and a lot of different harm reduction philosophies that were evidence-based, and that seemed easy enough for me to apply in my own daily practice. After this, I saw that my local safe consumption site was hiring, so I took that opportunity and started working there, and it truly changed my life. I love my folks, I love my colleagues, I love everybody who I got to engage with there. So some things I've learned about harm reduction was how to be creative when supporting my patients. This is kind of coming from a nurse's lens, so I know that this will be different than my other colleagues. But when, traditional routes of healthcare didn't serve the people that they were meant to serve and who were just as deserving and just as in need of care, we had to be creative in how we got to support people. And I think that that was something that was really different compared to normal medical care, where we were able to kind of get the avenues that we needed. And I learned to care without strings. It didn't matter, where my folks were at, didn't matter what was going on. It just mattered that this person needed support. So being able to apply that not only in my personal practice in harm reduction, but, in the future, it's been really awesome. Lastly, some advice to anybody interested in exploring it: do it, try it out. Whatever field you're in, you are going to bring such wonderful knowledge and support. I've worked with a lot of folks from mental health and psychiatrics, emergency department, public health, wound care and ostomy. Like, any sort of piece that you bring to the table is going to be so, so wonderful and so useful to your community and the folks who need that support. And the last thing is learning from people with lived and living experience. As a nurse, I think I came from a background where it was listen to me because I have the knowledge. Whereas in harm reduction, I didn't have the knowledge. I didn't have the skills. And the people who were the experts were the people who use drugs and have used drugs and were aware of the current climate and what I needed to know. So I think that being able to identify that is something that I really, really needed, and having the humility to know that what I needed to learn. So if you have that itch and you have the opportunity, I would highly recommend trying it. It's a field that has truly changed my life. On that note, I have some references on my slide, but I will graciously pass it to Pam, who will take over.
Thank you so much. Hey, I'm Pamela, they, them pronouns. I live and work on the unceded territory of the Algonquin and Anishinaabe people, so you might know that as Ottawa, Ontario. And NORS operates across Canada on the territories of many First Nations, Métis, and Inuit people. And just before I start too, I always feel like it's important to just shout out to the whole NORS team who brings valuable lived experience to the table. NORS was created by and for people with lived experience using drugs. And in October 2022, our founder passed away as a result of substance-related harm. So It's always important to me to name that loss, as well as Travis, Amy, Kate, and Devin. And with that, the ferocity of people's survival mechanisms, the ways that people can find healing and support in connection with their community. And yeah, just like the grief of folks who have been left behind after a substance-related loss. Yeah, and on that note, I am also very excited to tell you about our service, and then hopefully you can take the information and pass it along to people in your community, or I guess patients who might need it, who it might be useful to. So at its most basic, NORS is a supervised consumption hotline that operates 24/7, Canada-wide. We offer services in English, and occasionally we have French operators. We offer services over phone and by text. So I'll get into more about how that process works. NORS was founded as a partnership between Grenfell Ministries, who was operating an Ontario-only overdose prevention line out of Hamilton, Ontario, the University of Calgary, with Monty Ghosh, who's an addictions medicine doctor, and he was watching his patients kind of informally spot each other. And then the Brave Co-op and Craig, that now focuses their attention on overdose detection buttons and sensors that work really well in supportive housing and public spaces. So those are also very interesting to look into if you are kind of working in supportive housing, or you're having overdoses in public spaces in the buildings that you're working in. So then late December, those three came together to partner and to form the National Overdose Response Service. And we receive Health Canada funding through SUOP. Okay, so our main purpose is to, oh yeah, that's a good slide to have. Okay, so our main purpose is to take calls from people who use drugs, be on the phone with them while they're using, and implement a co-created safety plan if there is a suspected substance overdose or other adverse event happening while they're using on the phone. Because we can't see our caller while we're on the phone with them, we will decide it's time to implement a safety plan when the caller becomes unresponsive for a predetermined amount of time. So we will just have that conversation with people. So, hey, if you're using, the decision of how long do you want me to wait before I implement your safety plan might be 1 minute, 2 minutes. It might be longer if someone's using a different substance. We really do work with the caller to make sure that they are kind of in charge of their safety plan, and we are enacting it on their behalf. So your safety plan can look like calling EMS to their location, contacting a friend with a naloxone kit, or maybe someone's living in supportive housing and they want us to reach out to a staff member, or if they're on a hospital floor, maybe the nursing station. So ultimately, we leave that up to the caller, and then it's the operator's job to kind of think through the scenario to ensure that we have all the information that we need. So buzzer codes, alternative paths of entry, spare keys. If your emergency contact is your mom, for example, like, how do you want me to explain to her what's going on? Can I say you're having an overdose? Should I just say wellness check? And we try and find the most effective and efficient safety plan while honoring the person's autonomy in the situation. So the line is free, 24/7, Canada-wide. We are a confidential service, and we don't keep any identifying information. We get folks to provide a caller code so we can track unique users, but at the end of the day, if folks just want to make up a code, they're welcome to do that. If the caller's address is necessary to their safety plan, so like they want an ambulance to come to their address, we do need to know their address, but we don't record this or save it in any database, and it's destroyed after the call. We collect other information such as like what substance they're using. The phone call is going to go really different if someone is using an opiate versus if they're using ketamine, right? Or we get calls from folks who are trying a new substance for the first time, and they just want that extra level of safety and someone watching their back. And this is a community practice that people have been using drugs, have been using for years. So while NORS is like a very novel kind of Health Canada program, spotting is not new. it's like a very basic thing to have each other's back while people are using, to keep each other safe. So NORS kind of removes a couple of barriers. So geographical distance between supervised consumption sites and where people are living. We know that folks aren't really traveling far to reach in-person supervised consumption sites. You're more likely to go the closer you live. And so with the closures of supervised consumption sites, we are hoping that more people will be calling. And then, the rest of the country where there isn't a ton of access to supervised consumption, this is also really helpful. A lot of folks call in because of stigma and fear of being seen. They don't want to be seen accessing the safe injection site, either for personal reasons or, they just don't want to be associated, which is really too bad. Some supervised consumption sites close. They only operate between the hours of 8 to 5 p.m. and substance use happens outside of those times. And then supervised consumption sites don't typically offer inhalation. So lots of folks who are calling NORS are actually inhaling their drugs, which isn't supported at in-person consumption sites. There's a few limitations. Obviously, if someone is drowsy but not overdosing, we may dispatch for them if they are breathing, but we're just not getting a response. We have to base it on level of response rather than respiration rate or any sort of vitals, because we are doing this remotely. We will try and discourage police from attending to the scene if they choose an EMS dispatch, but again, we can't stop the police from accessing. So this is really problematic for folks who may have warrants or children in the home. And if police do come, they may confiscate folks' paraphernalia. So again, we plan through that pack before you poke kind of thing, tidy up what you don't need to have in front of you. And then, some people can overdose quite quickly. And there is a concern that emergency services or an emergency contact may not arrive in time. We have had 1% of our calls end in adverse events and 0 deaths so far using the service. So I guess that's a very good thing. And it means that things are working out well for people who call. We also get calls from people who are looking to support someone that they love who use drugs, or anyone who wants information about substance use. We do a little bit of peer support, a little bit of harm reduction and referrals for our callers. And then this is a cool new program that we have. So we just launched the Peer Wellness line. So there's 2 sort of main pieces to peer wellness. So there's short-term peer support case management, which is done by referral, and then kind of drop-in, but they're not drop-in because they're virtual services. So you can access them through the NORS website. If you scroll down to the Community Help Center, it's all in there. So the peer support case management is, the whole point is to leverage the power of peer support to assist people across Canada in their kind of movement across the continuum of care. If you are struggling with substance use or mental health challenges, the goal is to kind of address the gaps in services that people are experiencing locally, to have that additional systems navigation, especially during discharge from correctional facilities, acute care, detox, and residential treatment, because individuals leaving these settings have an increased risk of overdose and face additional barriers to care, and just overall difficulty accessing necessary support services. So it's to bridge those gaps. And then the kind of one-off drop-in services that are available are, we have a pharmacist, a nurse, and a legal consult service that's run by a paralegal. And again, that all can be referred through the website link. So, I mean, if someone's even looking, where do I need to get a lawyer for this, then Alana can hop on a call with them and kind of sort that out. Okay. I don't have any stats for the Peer Wellness line because it's a month in. Yeah, it's very, very new. But for NORS, I have a lot of stats. So we've taken 2,500 calls. And our first 3 years, we were pretty consistently seeing under 400 calls per month. And then in recent months, call volume has just exploded. So we're taking 800, 1,000, and our busiest month in December this last year was 1,400 calls in the month. Most of our calls are safer consumption with no adverse events. We've responded to close to 200 adverse events with no deaths, so that's really great. And a third of our calls are actually mental health related with no substance being used. And that was really a driving factor in the creation of the peer wellness line. This is just for June 2025. We're not seeing a ton of callers from Eastern Canada or from the North, but we have had callers from those regions. It's just not consistent. And yeah, Alberta and Ontario are really making up the highest call volume, probably because we started as a partnership between an Ontario and an Alberta-based organization. So most of our callers are calling from urban communities, which is not what we initially expected. So we figured that a lot of people would be calling from rural regions where there was less services. But here we are with a lot of folks calling in from cities. I always appreciate this gender uptick. So the majority of callers are women or gender diverse folks, about 80%, which I believe is actually inverse to what is seen at in-person supervised consumption sites where the majority of service participants are men. And yeah, there's a pretty large unknown gap just because we don't log the caller's gender unless they explicitly say it. We're not going to assume anything. So this is like what people have shared with us. Yeah, and I think that this really does speak to like some of the maybe safety concerns that might come up for folks while they're using for women and gender diverse people. And like, yeah, I don't want to draw too many conclusions, but I really appreciate that we're reaching this demographic. So most of our callers are smoking, which makes sense due to the inability to smoke at supervised consumption sites. And the majority of our calls involve an opiate, followed by methamphetamines. Okay, and this is really cool. This is our percentage of calls versus texts. I like a graph. Not everyone likes a graph. But in 2023, we introduced texts. More people are still opting to call over text the line. But we have some new information coming out very soon about kind of who is texting, why they're texting, that are maybe hopefully being published, just to speak more to the trends around texting the NORS line. And yeah, like text is really working well for folks who disclose that they maybe are deaf or hard of hearing, they have phone anxiety, youth, or those who don't want their conversations to be overheard for privacy reasons. So this is a QR code. If you scan it, it will take you directly to our website and you can explore there. On that website. You can order materials. It's free. Just go to like the swag shop, and then the community resource center is where you can find all the peer wellness stuff. And then there's a direct link to call or text the NORS line. Yeah, that's all I got. Thank you so much. I'm going to hand it over to Julia.
And good afternoon, everyone. My name is Julia. I'm the Nursing and Health Policy Analyst in RNAO. Today, I will provide a brief overview of how RNAO has emerged as a leading public policy voice in the area of harm reduction. As a professional association representing nurse practitioners, registered nurses, and nursing students across Ontario, RNAO has long upheld a strong commitment to health equity, social justice, and evidence-informed advocacy. RNAO has long recognized harm reduction as a matter of both public health and nursing ethics, especially the principles of autonomy, non-maleficence, and justice, by supporting individuals' rights to make informed choices, reducing preventable harm, and address structural inequities in access to care. Everyone deserves access to health care that preserves their dignity, protects their rights, and at the most basic level, helps them stay alive. RNAO's engagement in harm reduction advocacy dates back to 2011, when Vancouver's supervised injection facility Inside faced the threat of closure. In response, RNAO joined forces with the Canadian Nurses Association to present arguments before the Supreme Court of Canada in support of the site. Our advocacy contributed to a landmark decision that allowed Inside to remain open, setting a national precedent for the legal protection of supervised consumption services across Canada. In Ontario in 2016, when cities like Toronto were debating whether to implement supervised injection services, RNAO once again stepped forward as a strong advocate. In Toronto, RNAO delivered multiple deputations to the Board of Health and spoke publicly at city council meetings in support of these life-saving programs. This advocacy played a very important role in the city's decision to approve supervised consumption sites. To further strengthen this effort and to help ensure that supervised consumption services across the province were grounded in evidence-based practice, RNAO developed and released a best practice guideline focused specifically on supervised injection services. This work helped lay the foundation for a broader, more coordinated harm reduction network across Ontario and shape the province's harm reduction policy landscape. These efforts also set the stage for ongoing actions. In 2025, when the Ontario government introduced legislation banning supervised consumption services within 200 meters of schools and childcare centers, resulting in the closure of 10 sites, RNAO called for the repeal of this act and also intervened in a legal challenge against the shutdowns, standing firmly in support of evidence-based harm reduction measures. Beyond these landmark moments, RNAO has consistently advocated through many channels, as you see from this slide, including action alerts, resolutions, Queen's Park Day, Queen's Park on the Road, and Take Your MPP to Work. And there are many ways to get involved. Due to time constraints, I won't be able to go into details here, but after the webinar, we will send you a list of resources that provide clear steps on how to get involved. Next slide, please. Thank you. And this is our mental health in focus page. It includes mental health and substance use highlights and key resources. We strongly encourage you to explore this page to discover more about our work and available resources. That concludes my part. Now I will hand it over to my colleague, Sabrina. Thank you.
Perfect, thank you. So in terms of if there's any questions, can you please post them in the chat and or unmute your line and ask the question? There has been one question, Pamela, it's for you in regards to NORS. Anjali is asking, do you ask which location they are from, the caller?
Yeah, so when we are making a safety plan with someone, it can involve their address, but it doesn't have to. So if someone doesn't want to provide their address, we just need to have like a clear way to get help to their location. So maybe they want to provide an emergency contact, and so their emergency contact can either respond on the ground to do an in-person rescue with naloxone, or they might give that emergency contact permission to provide the address just to keep it safe so that there's kind of one extra step to get it. Both work. You know, if someone is in a shelter, and they know that there's a staff member 24/7 that I'm going to be able to reach to go and do a check, maybe in a dorm or a bathroom, then I don't need to know what shelter they're at. I just need to know that there's a responsible human who can come and assist in person. But most of our safety plans do involve EMS to an address. It's just not necessary.
Fantastic, thank you. Pamela, I know there's been a couple of questions that you've been answering in the chat, but maybe for the rest of the viewers, can you summarize in regards to print resources and or promotional resources, posters that can be accessed through NORS to promote the service within other sites?
Yeah, I have the swag shop open. I put the link in the chat. So we have business cards, we have printed totes, we have t-shirts, tumblers, and we have a ton of downloadable posters that are kind of like themed based on where you're trying to promote the service. And they all have the QR code and the phone number. Yeah, our business cards are also hard plastic, so you can use them to cut product and make lines and clean them off afterwards. And they're not going to, like, if you're living outside or spending a lot of time outdoors, they won't crumble like a paper card will. So that is lovely. And then we don't really do the pamphlet brochure thing because they tend to really appeal to service providers and not so much to people who are actually going to use the service. So yeah, we do like t-shirts with the number on it and other fun things that are actually, like, you know, useful to people to, like, have on them rather than just another piece of paper. So yeah, you can download and print all the stuff, or you can order it, and stuff is free. We will mail it to you for free.
Fantastic. Thank you. There was one other comment, Pamela, in regards to, is there a poster? And I know you said you weren't into paper-based resources, but if there a poster that has 2 contact numbers, one for peer support and safe consumption, if all spaces are a premium, is there one item that they could all?
I don't know if we have a Pure Wellness poster yet.
Okay.
I don't know. Let me check. They all seem to have the NORS number and not the Pure Wellness. But if you go to the Community Help Center, there is that image that was in my slides, and you can just download that, and it has the number on it.
Sure. I'm just skimming through the comments. There's a lot of love for NORS.
I love you guys. Thank you.
I think Rhonda had mentioned in the chat that with Monty's permission, they had created silicone bracelets and keychains that were printed with the NORS number. Amazing. Kasia, can you share the slide regarding sanguine? Paul Andre is asking for that. Paul, do you have a specific question? I know you're not shy. You can unmute your mic and talk.
I'll go back and pick this one. And if this isn't the right slide, please let me know. I'll get our website again and share. But we have a lot of wonderful folks who work in a lot of different programs, both with lived and living experience. Their peers are the backbone of so many wonderful things that happen in our community. Yeah, lots of stuff. I'll toss it back to Sabrina and Amber. Yeah.
I have a question for you, because I know you and I have talked a lot about this, and so I think this might be really valuable for the folks on the line right now. With the closure of the CTS site, can you speak a little bit to how that might have impacted Sanguine and kind of the work you're doing to support the community at this current juncture in time?
Yeah, so that was a big jarring experience for our agency, for the folks who work there, for the folks who went there. We're doing as much as we can to answer your question the best as I can. We're trying to set up, connections with folks. We bring NORS cards, my team especially, to lots of different locations, including emergency shelters, where people can support and find the opportunities to really connect with folks when they're using substances. But yeah, it's taken a lot to really come together and make sure that whatever help we did in the past can be kind of continue forward. People who use drugs also are very good at finding supports and pioneering those supports. So it's not to negate the important work that they're doing. It's just to see how we can fit in this new chaotic climate.
At this point, I would love to pass it over to Kathy Moreland to talk a little bit about resources that are available to support families with living and lived experience.
Well, my background in nursing is in oncology and palliative care, so you might wonder why I'm here, and my reason is right there. It's my son Austin, who died as a result of fentanyl poisoning at the age of 18. So harm reduction and the journey that we went on trying to get him help really made me passionate as a nurse about doing something about this. And International Overdose Awareness Day is an important time to sort of regroup and look at the resources that are available to people. And Austin was just 1 month after his 18th birthday succumbed to fentanyl poisoning, and he was denied treatment during COVID and also as a result of some previous mental health issues that he had. And so I became, this is the way I parent him now, is by fighting. I think before we finish, I just want to review sort of what we're talking about when we talk about an integrated approach to harm reduction, because we've talked about safe consumption sites, and certainly I'm well aware of the services of Sanguine because I was living in Kitchener when Austin died. And Sanguine is an amazing model. If any of you are looking at, whether you're rural or urban, an amazing model of how to care for people who are struggling, some of our most marginalized. And I am going to remind people that it's not just people who are living on the streets who are marginalized, who are struggling. We're still losing 20 people a day. So I don't know how well you can see this umbrella, but when I try to explain to politicians about harm reduction, I talk about using an umbrella as my model. And if you can see that each panel has something on that, including just preventing trauma in the first place, because people tend to use substances because of either experimentation or previous trauma, trying to cope with stressors and things like that. Not the only reason, but really important that we look at this. And so just to give you some idea of what some of those panels could look like, obviously prevention is the best harm reduction. Looking at safe supply, support for people who use drugs and their carers, including the frontline staff who care for them very much, and we don't support them enough, as well as families. Decriminalizing possession, certainly the consumption treatment services or safe sites that should include smoking as well as injections, and accessible, evidence-based, take people where they're at kind of treatment, which is still a struggle. So if you look at the umbrella, if you had all of those panels covered, you would in fact prevent more deaths and more lives would be saved. And so it's really important that we look at a comprehensive, including treatment. Treatment is part of that umbrella, is that we have to look at that. And then what's happening now is that we have a government currently in Ontario, and I think Alberta's doing the same, where they're putting all of their resources into treatment when in fact, and thinking that's going to reduce the deaths. And we now know in Ontario, we know that since the safe consumption sites have closed, there's been a huge increase in deaths as a result of these closures. So it's not the only answer. So I just wanted to point that out as sort of a tool people can use to help them explain this when you're advocating for change in your own areas. So what supports are out there for families and loved ones? I'm here as a representative, not just of RNAO, I'm a long-term member of RNAO, but also of Mom Stop the Harm. And Mom Stop the Harm is a network of Canadian families impacted by substance use related harms and deaths. And by family, we can extend that to aunts, uncles, cousins, good friends, etc. So although the name is Mom Stop the Harm, it is by no means closed to anyone other than moms. And what we do is we advocate for the change of failed drug policies. We've partnered with RNAO here in Ontario. We provide peer support to grieving families and assist those with loved ones who use or have used or are using substances. So if again, we'll put, if you go to momstoptheharm.com, you can either join that network if you want to, if you're caring for families who are either have people struggling with substance use or have lost someone to substance use, and that includes alcohol, you can certainly go to their website. So the two support groups that Mom Stop the Harm provides are Holding Hope, and those are for people supporting loved ones who have someone in their lives who is using substances currently. And it is peer-led, it is usually online, although some of the groups do meet in person, and there is no cost for that service. And the other one is Healing Hearts, which is a peer support for those who've lost someone to substance use related causes. And again, there's no cost there. Some areas, again, have in-person meetings and some are online. Very helpful. Some of the other supports that are available for families, and And if you're one of those people who is struggling, our Families for Addiction Recovery, which is FAR Canada, they offer parent-to-parent support, so one-on-one support, and also online parent support groups. And I found what I found very helpful, because I was living in Midwestern Ontario at the time, although you do not have to be living in that area, is the Bereaved Families of Ontario Midwestern Region has a specific group, a bereavement group for people who have lost someone to substance use. So all of these will be available to you should you. Again, I think the best thing I can tell people who are working with those who are family members is recognize that prior to someone's death, our worst fear is that we would lose this person to substances, and that when it occurs, it is like taking the weight of the world off your shoulders and stabbing you in the stomach at the same time. So when my son died, I felt like I didn't have to live with the chaos and the fear that he was going to die, but I have been carrying the burden of losing him for a long time, and I will forever, I think. So I just want to re-point out that the purpose of the International Overdose Awareness Day, which is why we're here, is to remember those lost to drug toxicity. And this country is still losing 20 people a day. And if anything else was happening like that, I think there'd be a lot more action. It's also a day to support those who are left behind who love them. And that includes their frontline workers and people that, like Pam and Kasia, who work so hard with them to support them, and to bring attention to the need to continue to demand evidence-informed integrated strategies for harm reduction and to fight stigma, which we know continues. So on August 31st, we're asking everyone to possibly take a moment in your day to light a candle and possibly take a picture of that candle and post it on your social media and on send it to RNAO so that we can post them. It is a way for you to acknowledge that those people who we've lost were people and not numbers. And thank you, Kasia, for saying that. It means a lot to those of us left behind. It brings awareness, and I want to believe that it honors our memory of them. This is a picture of many of the people we've lost. My son Austin is right there in the third row from the bottom, third to the, and in the bottom row, second in, is his dear girlfriend Alex, who succumbed to carfentanil poisoning 2 weeks after Austin died. She was huffing in her home, and she was only 16 years old. Up at the top, there's a number of Austin's friends in this picture. In the bottom right, there's a 2-year-old who was lost because she got into her mother's fentanyl while her mother was sleeping. So it's a tragic public health problem, and I really appreciate that I've all taken time out of your day to come and educate yourselves and reground yourselves in what can sometimes feel like a helpless situation. We are hopeful that we will continue to fight. We remember them, and on the 31st, I ask that you take a moment. These are some of the crosses that are put up in cities across the country. This is the IOAD event in Kitchener-Waterloo, and that is Austin's marker there, and many of his friends are also there. I would say after Austin died, at least 7 of his friends who I had met have succumbed. We're losing a lot of our young people. I'll hand that over now, I think, to Sabrina. Thank you.
Thank you, everyone, for being at our webinar today. I know we're right at 1:30, but if you could just stay for 1 or 2 more minutes more. Just wanted to say thank you to Pamela, to Kasia, to Kathy and Julia to share their expertise, their wisdom, and their knowledge in this area. I think you can see clearly that their passion exudes in the work that they do, and really at the end of the day, they're there to help. And they're here to share knowledge. So if you have any questions, we will take them after today's call, and I can email them myself to the speakers and make sure that we send out a coordinated response to everyone on the call. So please just let us know. I wanted to also announce that our MHSU, our Mental Health and Substance Use Program at RNAO, is excited to announce our inaugural MHSU Specialty Best Practice Guidelines, a Best Practice Spotlight Organization program. To learn more, please email mhsu@rnao.ca, and we do have our webinar tomorrow, August 19th, as well, that you can find on the RNAO webpage. And a kind reminder to join us on August 31st, to remember those that we have lost, to support the loved ones that they've left behind. Speak up. Overdose deaths are preventable, and harm reduction saves lives. Please light a candle, whether it's physical and or virtual, and share the post with RNAO on our social media, and we will reshare that as well. RNAO will actually post the purple one you see on the bottom right-hand screen, and we invite you to actually tag and to repost that as well. To our attendees, we'd love to hear your thoughts. There will be a QR code on the screen that's on right now. Please take a picture of that and load up our evaluation and complete the evaluation. Your feedback does help us in planning future webinars. Your feedback also does help us in understanding future direction too. So that would be really great. Within the week, you'll receive a link to the slides and all the resources that have been recommended as well too from today's webinar, and our bios for our panelists. Lastly, please remember there's power in numbers. Join the movement and become an RNAO member. At RNAO, we advocate for healthy public policy, promote excellence in nursing practice, and empower nurses to actively influence and shape the decisions that affect the profession. And right now, we have a promotion to actually get the first 3 months free. Thank you so much for attending today's webinar. We'll hope to see you soon, and have a great day. Bye for now.